Now, a new report has found that the level of dental care covered by Medicare is grossly inadequate. The research conducted for the Brotherhood of St Lawrence has put the cost of poor dental care at about $1.3 billion.
Meanwhile, the federal government has already been given a separate interim report into dental care failings by the National Advisory Council on Dental Health, but that report hasn't been released. It is believed, though, to make another call for a universal dental care system. Dr. Shane Fryer is the president of the Australian Dental Association. He joins us now from Sydney. Dr. Fryer, good morning.
Good morning.
What is wrong with establishing a Medicare-type system to cover dental care?
That would be the ideal thing to do, Michael. But with the practicalities that are involved, it's the costing of the system that's the big issue.
Do you believe Australians, you wouldn't believe Australians would be willing to pay a Medicare-style levy if it meant that they got access to affordable and if not free, adequate dental care?
Yeah, without a doubt. It's the size of that additional levy that may cause some concern amongst the community. I mean, we know that the main area of problems with dentistry is it's about 30% of the population that's not able to get access at the moment. The Australian Bureau of Statistics released a figure 2 weeks ago, I think, and in their report they said 26% of the population had advised that finance was an issue for access to the dentist, and we need to target a scheme at this group because they're the ones that are in need.
Okay, how do we, in the absence of a national scheme, how do we get that percentage of the population into a dental surgery?
A scheme that the government would propose would be terrific if they means tested and targeted the funding to that group of people that aren't getting there now. We need to address the waiting lists that are on the public to get into the public dental clinics. It's a big issue. There are people around that need a lot of care. It's complex care, and a very basic broad brush Denticare scheme is just not going to hit the mark.
What about encouraging dentists in the private sector to work in those public hospitals to help reduce those pretty huge waiting lists, as you say?
Yes, that's another point that the Dental Association has made. As a matter of fact, the association's working with the government at the moment to develop and introduce a scheme to make working within the public sector more attractive. We've also advocated to the government that the same incentives that apply to doctors to go and work in the rural and remote areas where there's an access and a need for the delivery of dental care, the same access or the same incentives that doctors get, it would be terrific if the government would apply those to dentists as well.
Shane Fryer, we're getting an awful amount of comments from our viewers this morning about the cost of going to a dentist. Many are saying that the costs for both basic dental services and certainly going to see a dental specialist are, to quote one tweet, obscene. Why do dentists and dental specialists charge so much?
Yeah, dentistry is a costly business. What you have to realise, we're virtually running mini hospitals. Even to the extent that practice accreditation in evaluating the premises is now being initiated and promoted by the association. Just to set up a dental practice, a very simple basic cost, you're looking at well over $300,000. It is an expensive business to be in.
And No, please go on.
I was just going to say that of about for every $100 that a dental surgery may receive, about 70% of that goes in expenses in just providing the service.
Now, we are looking at in some great depth at the Brotherhood of St Lawrence report this morning that points to the flow-on health and economic impacts of people not getting access to basic dental care. You, being at the cold front, so to speak, would see the impact of that. People who don't make it to the dentist, therefore suffering much more severe health consequences down the track.
Yes, that's always been an issue. There's a reason why the oral health promotion messages are attend your dentist regularly, because if you can get those problems when they're early, both the significance and the cost of the treatment is reduced.
Okay, Shane Fryer from the Australian Dental Association, thank you very much for your time.
No problem, thank you.